You've probably noticed by now, today is National Wear Red Day to raise awareness about the American Heart Association's Go Red for Women movement. Heart disease remains the #1 killer of women. And joining us now is Dr. Adome Quesada, Medical Director of the Christ Hospital Women's Heart Center. And Dr. Quesada, good morning to you. Thanks for joining us.
Thank you for having me. Good morning, everyone.
You know, I think a lot of people, when they hear #1 killer of women, I think that is an astonishing statistic that a lot of people just don't realize. And I would imagine the biggest reason that we have Go Red for Women Day, yes?
Exactly. Yes. We use today as a day to raise awareness that it is the #1 killer in women, that heart disease is not a man's disease, it's also a women's disease. And we're so excited to raise awareness because what we have found is that women are not recognizing that it's the #1 killer and therefore don't present early enough for their heart care. So that's so important that they do.
Yeah, and Dr. Quesada, it's funny you use the word recognize because we think of different ways to recognize issues with trouble with the heart. And some of the issues that women may have may be much different from what we think about in terms of symptoms that men have with heart problems, right?
Exactly. Yes, that's a great point, which is that women don't present the same way as men. Sometimes they do. Sometimes they have that classic crushing chest pain that leads them to go to the hospital. But when they present with other symptoms that are more common in women, which essentially any discomfort, pain above the waist, if someone feels just completely off, it's good to listen to their bodies and seek care just to make sure that they're not having a chest pain equivalent or a heart attack that can be preventable.
Even prior to that, prior to any kinds of symptoms and that kind of thing, what should women be doing for their heart health?
Yeah, so it's very important that we know our numbers. And what do we mean about that? And that's for everyone, men and women. That means know your blood pressure numbers. That means know your blood glucose, your cholesterol numbers, your weight, so that we can calculate a BMI. So that way we're able to know if someone's at a higher risk of developing heart disease and we can intervene early. We also encourage everyone to exercise. 30 minutes, 5 days a week of moderate activity is what you're aiming to get to. And of course, healthy diet, it's a very important piece too.
You know, already it was sometimes less likely that women would seek help for heart issues. Are you finding that's even more so during the pandemic?
Yes, unfortunately, I think that's across the board, that we're not having patients who have symptoms show up. And then what we have is the bad outcomes of a heart attack. Because if someone has the symptoms early and they present, then they have much better outcomes than if they show up a few days later. So we understand that these are scary times, but if someone has heart symptoms or they're concerned that there's something just wrong, it's important that they come seek at least an evaluation. And then from there, we can decide if there's a concern or not, rather than show up days later when it's just much worse for us, for everyone.
All right, Dr. Quesada, Medical Director of the Christ Hospital Women's Heart Center. Thank you so much for your time today, and thanks for helping us raise some awareness.
Of course. Thank you. Happy Red Day.
All right, take